Hello everyone. Welcome to another interesting lecture from my channel. As always, I am pharmacist Dr. Ezeudo Nwaozuzu. Today, I will continue our lecture on primary healthcare. Before we go on, kindly subscribe to the channel, if you haven't done so, and activate the notification bell, so that you don't miss any future videos from this channel. Thank you for your support as you watch, like and share my videos, and as you subscribe to the channel as well. Now, let's go on with our topic for today: medicine use and management in primary health care. The World Health Organization, WHO, defines health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Now, one of the major ways of achieving good health as defined by the WHO, is the adoption and implementation of the concept and principles of primary health care, which the World Health Organization also defined as essential health care based on practical, scientifically sound, and socially acceptable methods and technology, made universally accessible to individuals and families in the community, through their participation, and at a cost that the community and country can afford to maintain, at every stage of their development, in the spirit of self-reliance and self-determination. This is popularly known as the Alma Ata Declaration of 1978. One major component of primary health care, as I mentioned in part 1 of this lecture, is the Essential Medicine List. Essential Medicines List. As the name implies, this is a list of basic or essential medicines, needed to achieve the widest possible coverage of the population, with medicines of proven efficacy and safety, in order to meet the needs for prevention and treatment of the most prevalent diseases in the country. It is part of the national health policy. Factors to be considered in the selection of medicines for primary health care. For a medicine to be considered for inclusion in the Essential Medicines List, it must satisfy the following criteria. 1. It must have adequate scientific data generated from controlled studies. 2. It must meet adequate standards of quality, including bioavailability, when necessary. 3. It should be accompanied by concise, accurate and comprehensive drug information, drawn from unbiased sources. Guidelines for selecting medicines for primary health care. The following guidelines for selection of essential medicines for primary health care are intended to ensure that the process of selection will be unbiased, and based on the best available scientific information, yet allow for a degree of variation or flexibility, to take into account local needs and requirements. These guidelines include the following. 1. Medicine selection should be based on the results of benefit and safety evaluations, obtained from controlled clinical trials and/or epidemiological studies. 2. The international non-proprietary, generic, names for medicines or pharmaceutical substances, should be used whenever available. 3. Regulations and facilities should be available, to ensure that the quality of selected pharmaceutical products meet adequate quality control standards, including stability and, when necessary, bioavailability. 4. Cost represents a major selection criterion. In cost comparisons between medicines, the cost of the total treatment, and not only the unit cost, must be considered. In addition, the cost of non-pharmaceutical therapeutic modalities should be taken into account. 5. Local health authorities should decide the level of expertise required to prescribe single drugs, or a group of drugs in a therapeutic category. Consideration should also be given to the competence of the personnel to make a correct diagnosis. 6. The influence of local diseases or conditions on pharmacokinetic and pharmacodynamic parameters should be considered in making the selections. Example: malnutrition, liver disease, etc. 7. When several medicines are available for the same condition, select the medicine, pharmaceutical product and dosage form that provide the highest benefit-risk ratio. 8. When 2 or more medicines are therapeutically equivalent, preference should be given to A. the most thoroughly investigated medicine, B. the medicine with the most favorable pharmacokinetic properties, example, to improve compliance, and to minimize risk in various pathophysiological states. C. Medicines for which local and reliable manufacturing facilities for pharmaceutical products exist. D. Medicines, pharmaceutical products, and dosage forms with favorable stability, or for which storage facilities exist. 9. Fixed ratio combinations are only acceptable if the following criteria are met. A. Clinical documentation justifies the concomitant use of more than one medicine. B. The therapeutic effect of the combination product is greater than the sum of the effects of each. C. The cost of the combination product is less than the sum of the individual products. D. Compliance is improved. E. Sufficient drug ratios are provided to allow dosage adjustment, satisfactory for the majority of the population. 10. The list should be reviewed at least once a year, and whenever necessary. New medicines should be introduced only if they offer distinct advantages over medicines previously selected. 11. If new information becomes available on medicines already in the list, that clearly shows that they no longer have a favorable benefit-risk ratio, they should be deleted and replaced by safer medicines. The Nigerian Essential Medicines List for Adults 2020. In Nigeria, the 7th edition, that is the year 2020 edition of Essential Medicines List was released last month, July 2021 by the Federal Ministry of Health. This current edition separated medicines for adults from medicines for children. The Nigerian Essential Medicines List for Children 2020. The release of the 7th edition of the Nigerian Essential Medicines List 2020 was also accompanied by the publication of the maiden edition of the Essential Medicines List for Children. This was done in line with the recommendations of the United Nations Commission on Life-Saving Commodities, UNCLOS, which advocates for the need to pay special attention to the health of children and women as special populations. The development of this Essential Medicines List for Children will ensure the delivery of appropriate therapeutic interventions to children, as envisaged by the 2007 Model List of Essential Medicines for Children, by the World Health Organization, WHO. The World Health Organization further stated that this new list for children is a list of the most effective and safe medicines for children up to 12 years of age, the most cost-effective options for key health problems, and are accessible with little additional health resources. Contents of the Essential Medicines List for Primary Health Care. For both the adult and children versions, the Essential Medicines List contains 3 categories of essential medicines for primary health care. These include 1. Primary Health Care List for health centers. 2. Primary Health Care List for primary health care clinics. And 3. Primary Health Care List for health outposts. The contents of these lists are as shown on the screen. It is hoped that, with adequate adherence to the guidelines on the use of the Essential Medicines List, the lofty objectives of the 1978 Alma-Ata Declaration on Primary Health Care will be achieved. Thank you once again for listening, and God bless you. The script of this lecture is also available in the description of this video below. Feel free to check it out. We hope you learned something from this lecture. If you did, kindly like and share this video. Also support this channel by clicking on the subscribe button, as well as the bell button beside it, and select all from the options. That way, you will be notified of any other video we publish on this channel. Be informed that this is a computer-generated audio for this video, and not Dr. Ezeudo's voice. It was made to ensure that our audience in different parts of the world can hear and understand the lectures. Kindly let us know what you think about it in the comment section below. Till I come to you again, with another interesting video, I wish you the best of good health and success. Bye for now, and see you in the next video.